Good Monday morning and welcome to the Oakland County Megacast. I'm Tyler Keefe in the Lakes FM studios, joined by Ronnie Dahl in her home studio.
Tyler, great to hear from you on this Monday morning. You had a few days off. Do you have a good gobble day?
It was a very nice day. Nice, relaxing, calm day on Thanksgiving, which was a nice change of pace.
Did you try to cook for yourself?
I did spend some time with my mother, my stepdad, and my brother. I was wearing a mask the entire time, and it was distanced. So just a few hours over there, watching the Lions get destroyed by the Texans, which was just fantastic, especially with the news that came the next day.
Were you surprised? One thing we were talking about with the Lions, typically they wait until the end of the season to fire their coaches, but it happened right after like you said, the embarrassing loss on Thanksgiving Day.
Yeah, I'm not surprised. At some point, enough has to be enough, and you have to move on, and anything is better than what they're currently doing. That being said, I'm thoroughly waiting, and I'm ready to be disappointed by the Lions organization once again with the next decision.
That's what's going to be interesting. A lot of people are saying, a lot's not going to change next year. No. You're just going to have different coaches at the helm.
Yeah, it's going to be a different coaching staff, and it's still going to be the same ownership team tripping on their own shoelaces and then blaming it on the shoes. So
that's a very interesting analogy, though. It does give us a little bit of hope, though, doesn't it? And then maybe next year on Thanksgiving, fans can actually be in the stands as well.
Yeah, it'll be nice to finally have people back in Ford Field on Thanksgiving Day with their paper bags on their heads, cheering on the Detroit Lions.
So, yeah, as you said, we had Thursday and Friday off, though. Tyler, I should have tweeted you or sent you a picture while the Turkey Trot in downtown Detroit was canceled this year, or they had a virtual version of it. I was able to find a couple friends to put on turkey outfits with me. So we pretty much kind of salvaged the tradition because Sylvan Lake had a small turkey trot through the streets of Sylvan Lake. In fact, we had so much fun that we think we're going to make it a new tradition and keep our turkey trot right there in Sylvan Lake. And I will say, so a lot of people thought we were crazy, 3 turkeys running through the streets of Sylvan Lake. But we also had a lot of people laugh and smile and say that's exactly what they needed this Thanksgiving morning.
Well, that's good to hear. And like many other things during this pandemic, new traditions have risen in many individual municipalities or groups of municipalities. As some things go away, new things are then formed that maybe are similar and maybe are a little more wholesome and fun for the community than they would have in a larger scale event. So some good news coming out of Sylvan Lake over the Thanksgiving holiday.
So are you a big shopper on Black Friday?
Not really. I'm pretty conservative with with any shopping that I do normally. If it's something I have a use for, and then maybe I'll go for it. But generally, just some browsing and being like, oh, cool, and then moving on.
Yeah, so you're not getting up at 5 a.m. to get out there and stand in line and try to get the best deals.
No, I'm crazy, but let's not be that crazy.
So yeah, typically, back in the day, I would usually have to work the day after Thanksgiving, and of course, we always did the Black Friday shopping story. You do it every single year, but it looked like this year it wasn't crazy like it normally is because so many people are shopping online. And I guess the good thing to come out of this, there were no mad rushes once the door opened up for people scrambling to get that 1 or 2 items that they really were standing in line for. So it seemed like this Black Friday was a little bit more civil. So maybe that will stand and hang around post-pandemic as well.
I'm going to go ahead and doubt that. I think people will go right back to being just as absolutely insane, tackling each other, hitting each other, shoving each other for a pack of Legos when we get back to more normalcy.
Well, today is Cyber Monday,
Yes.
so a lot of good deals for people deciding to stay in, shop at home, because again, it is starting to snow out there. The winter weather advisory for here in our area starts this afternoon, I think officially at 3 o'clock, but we are starting already here in the Kego-Sylvan Lake area, starting to see a little bit of snowfall out there.
Yeah, it was nice waking up this morning. I heard on one of the other local news stations that it was snowing. I looked out the window and there was already a nice cover of snow on the ground. I let my cats out and they were once again mesmerized by how the ground looked outside. What was the stuff falling from the sky onto the balcony? They were jumping at the snowflakes on the window. And once again, I didn't take a video of it, so it didn't happen.
You really just need to set up a GoPro.
I do. I need to be spying on them all day so that I know exactly what they did when I get home, and when they give me a guilty look, I know exactly why they're guilty.
Well, I will say, so I broke out my snowman mug.
Very nice.
For today, since we're starting off this Monday with a little bit of snow out there, getting everyone in the holiday spirit. I know pretty much everyone in my neighborhood they were out yesterday putting up all their holiday lights outside before the cold weather came, although my husband did not do that, so he'll be out there at some point in time in the snow and the freezing cold hanging the lights. But of course, he had work yesterday, and talk about that lovely team of yours, the Detroit Lions.
I feel so bad for him sometimes that he has to go and talk about the Detroit Lions. There's not much good sports news going on here in the city of Detroit, and being on the Lions beat has to just be emotionally taxing on someone that enjoys football. All right, it would appear that we have lost Ronnie. Just a moment. We will stick around here and see if we can get her back. Just having a little bit of a freeze up. It looks like it may just be Ronnie altogether. So I'll keep it right here as we kick off this Monday edition of the Oakland County Megacast all throughout the local area on Civic Center TV and on 89.3 Lakes FM, as well as on Birmingham Area Municipal Access, also on Comcast Channel 15 and AT&T Channel 99 in the local area. We're online, civiccentertv.com as well, and we are on 88.1 The Biff, 88.1 WBFH, a service of the Bloomfield Hills School District with operations out of Bloomfield Hills High School under the leadership of Station Operations Manager Ron Whittables, and we thank them for joining us each and every day here. And as well, we are on the West Bloomfield Chamber of Commerce Facebook page via Facebook Live, so go ahead and give them a like. A big thank you to Vito Kukuru, and their social media guru over there, and Suzanne Levine as well. Looks like we do have Ronnie back with us so we can continue on with where we were at. Ronnie, this technology that we're all using right now, and especially during the holiday season where even more people are using technology as they're trying to avoid COVID-19, it can get a little more difficult for everybody to stay connected.
Yeah, and I always wonder, we've only had a couple technical glitches here on this show since we've been doing it, which has been pretty amazing. Yeah. But think about all the teachers, the courts, when they're doing some of these cases and there's a leg or something like this happens. But you know what? It's kind of the way of the world right now, and we are all getting a little bit used to it. We have a lot to get to on today's edition of the Oakland County Megacast, but let's go ahead and start off with some of the headlines as well. The governor wants the Republican-controlled legislature to pass a state-based stimulus plan of up to $100 million in response to the COVID-19 pandemic that's ravaged Michigan's economy. The issue could become a focus of negotiation during the lame duck session, the period between the election and the end of the year, when unresolved bills officially die and term-limited legislators depart. Whitmer is seeking up to $100 million that will provide direct financial support to the families and small businesses that have been hit hardest by the pandemic. The Michigan House and Senate have 9 session days scheduled for the month of December. They begin tomorrow. The final scheduled session is currently December 17th. She is calling on that, Tyler, because as of right now, it still looks on the federal side, they are unable to get any type of deal done. And I think about all of these families from the movie industry to the restaurant industry, and so many people unable to work right now. And we're coming up to the holidays. This has to be a hard time for them.
It does. And you know, if the federal government's not going to provide the help that has been called for months, not only from the state of Michigan, from our leadership, particularly the governor, but from leadership on both sides of the aisle throughout the union, if that's not going to be coming anytime soon, then these states are going to have to take those powers into their own hands, that burden into their own hands, if they can do so, to provide for some of these people that have been trying to get work or have some part-time work or are collecting unemployment, and it still isn't entirely enough for them to get by, especially during the holiday season. This has been something that Congress at the federal level has been working on for several months and has just not made progress, whether it's the Democrats wanting one thing and shutting out the Republicans on what they want, or vice versa, where the Republicans want one thing or another and shut out the Democrats. There is no common ground being found there, despite the absolute need throughout the country for a second stimulus, especially as COVID-19 surges and some businesses have to be severely restricted in order to prevent the spread of the disease.
Well, one of the things that has been an important tool in trying to contain the spread, obviously testing, but because of the colder winter months ahead of us, Oakland County is going to be relocating some of its testing sites. So remember those drive-through COVID-19 testing locations?
Yes.
They're being relocated as the colder weather sets in. In Oakland County, tests are going to be available on Mondays at the Old Holly Fire Station, Tuesdays at the Rochester Fire Station, Wednesdays, Southfield City Hall, the employee parking deck, and Thursday at the Pontiac Fire Station. The new testing locations will be open by appointment only from 9 until 5. Tests are available to anyone age 4 years and older. Youth 17 and younger must exhibit COVID-19 symptoms and be a resident of Oakland County or attend a school here in the county. There is no charge for the test and no prescription is needed, but we'll have that information on our website, civiccentertv.com. If you do need to go ahead and get one of those tests, just click on the coronavirus tab. Also, I don't know if you happened to catch the Sunday morning news shows yesterday, but Detroit's mayor, Mike Duggan, told a national television audience Detroit is doing a better job fighting the novel coronavirus than its suburban neighbors, and estimated it will take several months to vaccinate all Detroiters. He was guest yesterday morning on the CBS Face the Nation show. The mayor said America has never faced a challenge like administering vaccines to so many people. He said it would likely take several months to vaccinate Detroit's approximately 700,000 residents. Now, if you remember back in the beginning, the city did establish and operated a drive-through coronavirus testing site, tested more than 1,000 Detroiters a day. Duggan said he hopes to establish multiple testing sites set up in large parking areas surrounding the city's arenas, and they want to vaccinate as many as 5,000 people a day. Of course, frontline workers would be most likely the first to receive the vaccine, and then they would look at older Detroiters or those in nursing homes 65 years and older. But he did mention in the show, if you didn't see the interview, that they have been having talks on the state level with the governors and our elected officials on how they're going to try to figure out how to roll out this program to get people vaccinated, because we are hearing vaccines are actually being shipped right now in anticipation that they are going to get full approval here in the next week or two.
Yeah, it looks that way. They're on the fast track. They're certainly really close to getting that approval. And as that's happening, municipalities, especially large municipalities and other government entities, need to prepare themselves to prepare the to distribute them to the public, because this isn't going to be something where every individual has to make a doctor's appointment and do it on their own time. It's going to be something that's going to be very regulated by the government to make sure that those that need the vaccine first are going to get the vaccine first, and then that it gets to everybody else safely and properly as they try to spell an end to the COVID-19 pandemic.
So you can find the news headlines each and every morning on civiccentertv.com. Just click on coronavirus. At the top of the page, you'll also find direct links to resources such as the CDC, the state of Michigan, and Oakland County, their websites as well. We have a lot to get to on the Monday edition of the Oakland County Megacast. We're going to take a quick break, but when we come up, our first guest will be Gleaners Food Bank. It's a tough time for so many people. Even prior to the pandemic, families were struggling. Now more than ever, we'll be talking with the Director of Marketing for the Gleaners Food Bank when the Oakland County Megacast returns.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Parks COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
These are tough times for so many Michigan families. I mean, even before the pandemic, one study estimated 15% of Michigan's kids suffered food insecurity, and that number is growing, and it's continuing to grow as more and more businesses are having to take a pause. But helping to fill in the gap and help our families, the Gleaners Food Bank, you've been a staple in our community for so long. To talk a little bit more about the work that they are doing, Terry Collia, he's the Director of Marketing. Thank you for being with us.
Thank you. Appreciate it.
You and your entire team over there, you are some true heroes, and not only in the middle of the pandemic, but prior to the pandemic as well. But do you want to talk a little bit? I would imagine the need is up right now, especially after this recent 3-week pause.
Yeah, we've seen a pretty dramatic increase in our food distributions. Prior to the pandemic, there's an estimate of around 566,000 or so food insecure folks in our service area, which is the 5 counties surrounding Detroit. Feeding America, which is the national governing body, has estimated upwards of another 212,000 on top of that because of the pandemic. So pretty staggering numbers, over 700,000 folks who are having some kind of food insecurity or hunger issues. And we tried to step up and address that in the best way we could, starting right out in March. As soon as the orders came down from the governor, we were changing our approach and trying to address all these folks.
And how do you do that? Because in the middle of this, people are also maybe they don't have the resources to donate like they once did. Companies maybe don't have the resources to donate. So I would imagine there's probably a gap there that you're trying to fill on top of the need being greater.
Yeah, I mean, from the fundraising side of things, obviously you need that element to try and support all the programs that we have in place. And as I mentioned, we added some new initiatives back in March that were just basically designed to address this issue. Do it safely, of course, social distancing and all that was a big factor, but also to get to the different parts of the community that needed support that maybe we weren't serving as readily before. So fundraising was a big thing. It's my team's one of our top focuses. We're communications folks, we're marketing folks. We tried to get that information into the community as best we could. But end of the day, we've had some great support. I mean, some folks, yes, were hit. Some businesses couldn't support us maybe as they had in the past. But other corporations and foundations and folks that have stepped up. So we were able to meet that need. For us, it came in the form of distributing food via this mobile distribution model that we hadn't really done before. It's basically a large semi-truck. We've got pallets of food. We take it to a site. We unload in a parking lot. We've got a whole host of team members that do this. It's like an assembly line. They get it done very efficiently, very quickly. And then it's a line of cars. And cars come through. They get their bag of groceries, and they're on their way. So it's safe. It's quick. The volume is maintained the last 8 months or so. But for us, that's been the big thing, just try to find a way to address the need.
And with that, Terry, what about volunteers? Are you experiencing a shortage of volunteers, or do you have more people able to help out because they are maybe remote working or college students remote learning?
Yeah, so for volunteers, I mean, everyone probably thinks, food banks, you think of, food drives, you think of volunteering and that kind of thing. And these are important elements to what we do. But with the pandemic, of course, and especially safety was a top concern for us. The number of volunteer shifts available decreased. We couldn't have folks in our facilities. It just wasn't quite as safe. So we had to rely on the few choice opportunities we had for volunteers, but really it was getting a lot of temporary workers to come in and staff these mobile sites. We hired upwards of 80 or 90 some odd temp workers back in the spring and maintained a lot of those, and we're fortunately able to convert some of them to full-time as well. But that was really what helped us address the issues.
So where do things stand right now? We just went through Thanksgiving. Did you see the need increase prior to the holidays with this latest pause?
Yeah, there was a bit of a bump. A lot of folks, I think, even thinking of the holiday itself, needed food for that time. And some places are on, holiday or whatever, they're closed down, so they needed to get out ahead of that. For us, a typical month is maybe distributing 3.5 to 4 million pounds of food. Really, since the pandemic, and it's been pretty consistent, we're closer to 7 million pounds of food going out the door. So, it's kind of mind-boggling at times. But aside from all the numbers, for me, it's kind of like this. There's two sides to it. There's the technical side, and then there's like the human interest side. And just last week, I was at a mobile distribution site, meeting a photographer for a paper who was there. But you see, the folks, they're very efficient. They get stuff laid out, and then you see the line of cars forming even 15 minutes before the distribution starts, and it's wrapping around the parking lot. It's wrapping down the street. It blows your mind. On one hand, you're a little, upset by the fact that this is happening, but on the other side of it, you see folks getting their food, and when their masks were on, you could see a smile. You could see folks were very pleasant and in good spirits and that sort of thing. So we know we're helping. We're trying our best, and so far it's been a positive thing.
So as we're 8 months into this, sure. And I'm sure in the beginning it was, trying to readjust. Now you're in a new rhythm. Where do you think you're going to be, and your organization will be in the next 3 months to 6 months?
Yeah, the increased distributions that we've done for food it was an emergency response for a time, but it's our new normal now. We had upwards of, I think, around 70 mobile distribution sites that were new during the peak in the summer there. We made that a little more efficient, got down to about 48 sites now, but we have plans over the next quarter to get that back up to around 90 sites. Because we have some additional resources that we want to leverage to get the food out where it needs to be. So it's the new normal for us. These extra mobile distribution sites are going to happen. Maybe barring weather, I guess, is the only factor that'll come into play. But that's our plan. We're not going to stop. We're going to keep doing it. There's a need there. There's a meal gap, as you mentioned, and our goal is to address that.
Gary Collia with us here on the Oakland County Megacast. He's the Director of Marketing for Gleaners Food Bank. How is your organization impacted when the decision comes down from school districts to go remote? Does your need for food then go up?
It definitely does. There's estimates that, I want to say across Wayne County, for instance, right? There's 20 to 30% of folks are basically dealing with hunger. About 80% of that number is people with children. So if you have kids, it's a big thing. Of course, you want to feed your kids. A lot of folks don't realize hunger and food insecurity is not a situation where you're maybe homeless or you're I guess, the bottom of your rope kind of thing. But it's folks who are maybe laid off during this pandemic. It's a new situation for them. It's as you mentioned, the kids who are in schools. If they're getting a meal or two at school, everything's great. You take that away, that makes a bigger negativity coming on the family. It's a big stressor. So as soon as those orders come down, we definitely see some spikes in our mobile sites. But again, having those available, and a lot of times those are taking place at schools, it makes it good that we can address that in that way.
What's the one positive do you think is going to come out of this crisis for Gleaners?
Well, honestly, we pushed ourselves to the limits. I mean, our facility is quite old. I mean, don't want to beat around the bush with that one. It wasn't really made for the volume of food that we're putting out, but we found a way to make that happen. So it really, for us, number one, gives confidence that we could actually do more than even what we thought we could. I mean, I come into the office on occasion, when we're able to, and we have pallets of food in our conference room and that kind of thing, but we're making the space work as best we can. So that was one positive for us, that we could push ourselves even further and still maintain a level of productivity that was very high. And aside from that, it's been the community support. Again, like you mentioned, with some folks are on difficult times and maybe the volunteer shifts aren't quite there, but we've seen a pretty big increase in folks who've been willing to step up and support us in varying ways. So the fact that that's still happening despite this pandemic has been a big eye-opener and really heartwarming for us.
And so going forward, we are going into the Christmas holidays. Again, another time where it could be hard for so many people, because I think about this latest pause and you wonder about the employees that were maybe just barely making it, right? Because they don't have that federal stimulus check to help them now. So, your restaurant workers, your movie theater workers, a lot of them making 10, 12, 13 bucks an hour. Now they're just trying to pay their bills, but the need for the food goes up. Do you think this is going to continue until a vaccine is widely available?
We prepared for that possibility. We think it's a very real possibility that could happen. There's this kind of dynamic, obviously, I think you guys were mentioning earlier on the broadcast that there's snow and things and it's getting colder out. And we see this every year, but I think it's more so coming at us this year. It's this idea of do you heat your home or do you eat? It's this like heat or eat dynamic. And that really shouldn't, it blows my mind. It shouldn't be a thing, but it is for a lot of folks. It's very real. So again, I mentioned my team, we're the marketing folks, we're the fundraisers. We try to do our best to support the organization in that way. We set up a lot of opportunities for folks to get involved if they can to support. Starting even tomorrow, it's Giving Tuesday. It's a global initiative, but we get on board with that. We get a match sponsor to help people's dollars go twice as far. And then we bring up another opportunity in a couple of weeks. It's our Double Your Donation Day, we call it. These are just ways, again, to get the funds that are needed to address the folks that you mentioned who have that need.
Do you want to talk a little bit more about those programs starting with Tuesday?
Yeah, that'd be great. It's Giving Tuesday it's a really fun day. I mean, a lot of folks are aware of it now. It's not really hiding in the shadows. It's a pretty known deal. It's a global phenomenon at this point. But for us, it's about leveraging our partners. So we're getting together with the William Davidson Foundation. They're going to be matching donations up to $100,000 that day. So that's huge. Of course, a lot of folks they have that philanthropic drive. They want to support our organization, but those types of days are a little bit better because the dollar goes twice as far, right? So that's happening on Tuesday. The following event is on the 15th, December 15th, Double Your Donation Day. We do a few of these throughout the holiday months. We partner with Fox 2. Usually they do a great job of broadcasting what's going on. We have a phone bank of volunteers at one time. Now it's mostly employees, just for safety reasons, but they can accept donations on the phone. And then we have another match partner. Kroger is going to be matching funds that day as well. So it's just an opportunity for folks to kind of get a little excited about it and know that their money is going further. And end of the day, that's what's best for us, that people still get involved and still support the initiatives that we have.
And Terry, I know some people like that feeling of actually buying the food and donating the food. But I know organizations such as yours, money is a better option because you can make that dollar stretch further. How does that work?
Well, quite simply, it's based on our relationships with different food partners and things. If you buy, a can of beans or whatever it is, retail cost, that can be upwards of, maybe double the cost that we're paying for, right? So as much as we appreciate the classic food drives and not in COVID times when it's not necessarily safe to do that, it's still kind of a fun way to rally your community and get folks involved. But end of the day, and especially now, the dollars go so much further for us. And given our circumstances with safety and trying to maintain distance and that kind of thing, it just doesn't really make a lot of sense. So of course you can go to our website, gcfb.org, and make donations and get on board on a double your donation day, that kind of thing. But for the folks that really like that food drive element, we actually launched a brand new site back in the summer, which is basically, it's called a virtual food drive. You can sign up for your company, your organization, yourself. They're customizable with logos and graphics and things, but really it's just a way, it's like an e-commerce shopping experience. If you've bought things on Amazon or something like that, same idea. So you go on there and you purchase, I'll put it in air quotes, but you purchase the food, and that's how you make your donation to us in kind of a fun shopping kind of way. So it kind of replicates that food drive element, but in a virtual format.
Yeah, because when you talk about the safety element in this, how has this been for you and your teams at trying to keep your staff safe as well in the middle of the pandemic, but yet you don't have the option of not being on the front lines and giving this food out?
Oh yeah, I mean, my team in particular is fortunate. We can do a lot of our work virtually because that's kind of the nature of our jobs. But the vast majority of folks at Gleaners Community Food Bank, they're operations staff. They're going to be program staff. They're like the temp workers I mentioned who are manning those mobile sites. You mentioned the heroes and the folks that are doing the work. Those are the main people that are driving this effort for us. And yes, they have to be on site because there's a lot of physical moving of things and tons of trucks coming and going and food being moved around, that kind of stuff. So it's kudos to our programs team and our operations folks who've laid in some very strict protocols that follow pretty much in line with a lot of the statewide recommendations. But if it wasn't for that, we couldn't have executed. So safety is always top of mind for sure.
Well, it's great to have you with us. Just another minute or two with us here on the Oakland County Megacast. Anything we didn't ask that maybe you want to touch on before we let you go?
Well, I think it's important to emphasize, how appreciative we are of the support we've received, because I know a lot of folks are dealing with struggles and different things at this time, and we've seen some pretty significant corporate donations and things that have supported us and helped us greatly with some of our initiatives. But even I have the opportunity, I can kind of go through some of our emails and things that we get and messages, and you see folks they straight up say, Gleaners has helped me in the past, so I have this small amount of money, but I'm going to give it to you. And it really moves you in an emotional way because they don't have to do that. Maybe they're just getting back on their feet despite all of this, and yet they still make a conscious decision to support the organization that helped them in the past. And I've been with the organization for about 1.5 years, so not even that long. But I've seen a lot of pretty amazing things in that time. So from all of us to all of you, it's maybe a cliche, but thank you so much. We're very appreciative of the support in that way.
Well, and from the community to you and your team, thank you for always being there for our community. Gleaners Food Bank, such a vital part of our community here in the greater Metro Detroit area. You and your team are an amazing part of us, and so many people need your services. And, we want to remind people too, don't be too proud to reach out for help. A lot of people, their pride gets in the way. But it's okay to ask for help. And I know that you and your team are there to give that help as well.
For sure. Yeah, I appreciate you giving us the segment to kind of share that information. It's a great story. And again, that stigma, it shouldn't be there. We're all here to help. That's what it's for.
Well, thank you so much again for being with us on the Oakland County Megacast. We're going to take a quick break here, and when we come back, we'll shift focus just a little bit, and we'll bring in the director for the Center for Health and Research Transformation out of the University of Michigan. So a lot to talk to on the Monday edition of the Oakland County Megacast.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And Step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Great to have you with us on the Monday edition of the Oakland County Megacast. Just a reminder, you can catch Tyler and I Monday through Friday, 10 a.m. till noon. You can watch and listen to us on Civic Center TV, Birmingham Area Municipal Access, Channel 15 if you have Comcast, Channel 99 if you have AT&T. Also, tune us into the radio if you're out driving around, 89.3 Lakes FM, 88.1 FM The Biff. We also want to say thank you to the Greater West Bloomfield Chamber of Commerce for allowing us to live stream today's edition of the Oakland County Megacast on their Facebook page. Always a great partner here at Civic Center TV, and we want to say thank you to them. One of the things that I love about this show, 8 months into it, and every day I learn something new because we have such a wide variety of guests. I'm excited to talk to our next guest, Marianne Udow-Phillips. She's the director for the Center for Health and Research Transformation out of the University of Michigan. Marianne, thank you so much for taking time out of your Monday to be with us.
Happy to be here, Ronnie.
For those not familiar with the Center for Health and Research Transformation, give us a little bit of background.
Yeah, so we've been around for about 13 years, and we are a nonpartisan organization that's here at the University of Michigan that's really designed to help policymakers make decisions based on facts. And we do have a goal to improve access to care and population health and evidence-based care. And we do it through a variety of publications and through running demonstration projects, but we're really focused on how can we improve health of our communities, our state, and really nationally.
This must be a fascinating time for you and members of your team. I mean, first, we had so many issues as a country surrounding healthcare prior to COVID-19. But now I think one thing this crisis has done is really highlight some of those issues that need to be addressed.
Yeah, you're absolutely right. I mean, healthcare has been an ongoing issue in our country, an ongoing issue about how we cover people, how we provide services, how we improve quality of care. It's always been an incredibly important and very personal issue to everybody, right? And so since the Affordable Care Act passed, it's been a very political issue as well. And we've had lots of debates about what the structure of financing of healthcare should be. But since COVID happened, we've also had, I think, a deeper understanding of the role of public health. And I am a public health professional. That's my background and it's my training. And so it is, you're absolutely right. It's a phenomenal time for those of us to be in healthcare and really trying to help contribute in this really difficult time in our country.
Well, I'm excited to have you on. My niece actually graduates this May from the University of Michigan in public health. So she's looking into this arena. And I think a lot of people don't understand exactly the magnitude of the work that you and others such as yourself do, not only in the state of Michigan, but across the country.
Yeah, you're absolutely right. Well, I'm so delighted that she's at the School of Public Health. That's a great program and a great degree to have. And we see that impact right today because, really what public health is all about is about trying to prevent things before they happen, right? So, when we spend a lot of our time talking about medical care and how to deal with, the diseases that we get, but we don't spend nearly as much time talking about how we keep our population healthy and how we prevent those diseases from happening in the first place. So public health is very broad, includes everything from healthy lifestyle and healthy behaviors. But now, as we see, for example, the disparities in the impact of COVID on populations of color, it really speaks to the economic issues that people live in, the environment they live surrounded by, as well as just the basic science of epidemiology and how diseases spread and transfer between people.
So with someone with your background, when COVID hit, were you aware that this was out there, that this was a possibility?
Oh, yeah. Absolutely. Of course, we follow, of course, all the data. So we saw what was happening in China, when it hit there in December and January of 2020. We knew it was going to come to this country. We didn't know how fast, and we didn't know how prepared we were as a country. But certainly in March, when it began to take off in the US, we had lots of discussions. I did lots of webinars for people on what was likely to be the trajectory in the US. And because we spent a lot of time understanding our healthcare system and know how different it is from what the systems are in Asia and in Europe, we predicted we would be very hard hit as a country and that it would be a big challenge in our country. I don't think we predicted it would become as political an issue as it has become. And so the whole issue about, the preventive steps that people take with masks and with social distancing, early on, I don't think we thought those would be quite as political as they have unfortunately become. But it's been really an education, I think, on the importance of the work you do. How do we communicate to people? How do public health professionals get across these important measures that people need to take and why? And I think that's something we've really been tracking through this whole pandemic.
Marianne Udow-Phillips with us. She's the director for the Center for Health and Research Transformation out of the University of Michigan. You're an independent nonprofit health policy center. And even though there is that word independent, I know one of the things that you and your team did early on was also look at the spike of COVID cases within our state's nursing homes. Do you face any political pressure ever? Or are you and members of your team able to separate the two?
Yeah, I think that's such a great question. I'm really glad you asked it because I think we pride ourselves in being guided by the evidence and not by the politics. And we really value being in this really independent role. That's not to say that people don't interpret things through their own lenses, right? So we did do the study that you're referring to. The state asked for our help to understand both how they had intervened early on in the pandemic with nursing homes. What had they done? Had they done the right things to keep people safe? The death rates are so high in nursing homes, and they continue to be high. So it was an issue of great concern to the state, and they wanted recommendations of what to do going forward. And the governor also appointed a task force to help with those recommendations. So early on, we were funded by the Health Endowment Fund, a foundation, as independent. We assembled a team of scientific and strategic advisors who were independent. We interviewed people across the country. Our work was done without the state pressuring us one way or the other. They really, really just wanted to know. But our conclusions were that, early on, the state's approach was reasonable. We know more now, and we made 50 recommendations about how they could strengthen, and they are implementing those at this time, which is, incredibly timely given that we have this uptick in cases. So we think that they made reasonable decisions, but that doesn't mean that in the political process, when they debated it in the legislature, they didn't think that because we said something positive about the state that wasn't a political decision, but it wasn't. It was entirely guided by the science and in our analysis.
So now we're on the verge of a vaccine.
Yes.
How do you think that's going to play out in our communities?
Yeah. Well, of course, that's an incredibly exciting development. And here at the University of Michigan, our colleagues at Michigan Medicine are preparing actually for the first doses to be here in the next couple of weeks. I mean, it's amazingly quick that we're coming to this point. And we expect that the first people who will be vaccinated will be healthcare workers, because they're on the front lines dealing with the patients. They're really at high risk. And then the next group will be seniors, those in nursing homes, right? Those who have a lot of risk factors. And so it'll roll out over the next several months. And of course, there's lots of logistical issues with getting enough doses and getting enough vaccine to people. And I think the other issue we're going to have to be watching is how many people will take the vaccine. You know, we've seen some surveys that say 50% of the population say they won't take the vaccine, they don't trust it. And so there's going to be another big job for public health and for physicians in particular, will be to help people understand the safety and the efficacy and why they should take that vaccine. So it's going to be a process. I think, it's really important to listen to the guidance from Dr. Fauci. This disease is not over. It's not going to be over in the next few months. It's still going to be with us through 2021. We still need to take those precautions of wearing masks and social distancing, but there is hope on the horizon. That's the exciting part.
And I wonder, from a public health standpoint, your thoughts on how the vaccine is going to be rolled out. One of the issues with the Pfizer vaccine is the extreme cold temperatures that it must be maintained at. And I worry and I think about some of the communities, like the migrant communities or those, way out in the country. I mean, these coolers to, the refrigerators to keep the vaccines safe, they're not cheap. So are you anticipating that there could be a public health issue that needs to be addressed before the vaccine is rolled out?
Well, you're absolutely right. This is a complicated vaccine, and not only does it need to be kept extremely cold, it needs to be given in 2 doses. And so that's always harder to get people to come back for that second dose. The Moderna vaccine, there's another one coming out, is a little bit less complicated, but there is no question that we're going to have big challenges, in particular in rural areas in our state and in our country. And we're already seeing really high COVID cases, particularly in those communities, with hospitals overrun. And it's why, I said earlier that it's important for people to know that even with this vaccine coming online, COVID is still here and the cases are growing right now. And of course, everybody's worried with what happened over Thanksgiving. Are we going to see, more cases coming in over the next several weeks? So people still need to be taking those basic public health measures. They're really challenging for people. But even if we all just wore masks, it's amazing what the masks by themselves do to reduce the risk of COVID-19 if we had enough people using them. And so that is really the easiest thing people can do, is just wear your mask constantly and, socially distance. I mean, we know the places where you're most at risk. It's in indoor settings with groups of people. And whether it's, in your home with groups of friends, or whether it's in a restaurant sitting down to eat when you don't wear your mask because you're eating, right? Those are the places that are risky, and people need to really try to do what they can to mitigate the risk, because it is going to take a while, and we are going to have areas that the vaccine, it's going to be harder to get them to, as you said, than other areas.
Marianne Udow-Phillips, the director of the Center for Health and Research Transformation, joining us on the Oakland County Megacast. And Marianne, you mentioned with some of those vaccines, there is a multiple dosage process for being vaccinated. And you also mentioned earlier on, you made a good point about the process of distributing and getting these vaccines out to the population as it is most needed and most prudent. With that being the case, I think on top of just those issues, in general society, there seems to be some misconception that once the vaccine's ready to go and it starts to be distributed, the pandemic is over and we're all set and we're all good to go. What is the public health community's What will be the public health community's focus and their message as we go forward into the vaccine process? Because this is a process, and it's not going to be a magical light switch that suddenly stops the spread, especially as we're at a point in time right now where spread has been rampant all throughout the United States.
Yeah, you're absolutely right. And I think that is one of the big challenges for public health because the message is complicated. It's not an easy message. It's not a get that vaccine and you're fine, right? Because as you said, some of the vaccines require 2 doses. And it requires a time period before the vaccine is effective. So it's not effective overnight. It's not effective after 1 dose. So you still have to be careful. And we know there are a lot of people who still have a lot of questions about vaccines and the safety of vaccines. So if a lot of people don't get the vaccine, this vaccine, what's exciting about it is from the data we've seen so far in the trials that have been done, it's 95% effective. But that it's not 100% effective, right? So we need a lot of people to get the vaccine. It can't just be you getting your own vaccine because you still could be exposed. You don't know if you're in that 5% where it's not effective. And so the message is going to be from public health will be both to try to assuage people's concerns about vaccines in general and the safety of this one in particular, and get people to go in and get the vaccine and get the 2 doses if it's needed. And it will also be a message to say, even with that vaccine, until we have it more widespread in the country, you should still be wearing your mask. You should still be taking precautions. Things will ease up. We'll be better prepared to be back to a more normal life, but it won't be over. It's going to be a year. I mean, I really think people need to understand that this is going to be through 2021, and we'll still have to be taking some precautions, but they should be less. So it's going to be very important to get those messages out to people in general.
And Marianne, with that, what would you give an overall grade to our elected leaders? Either party, no party, it's not a partisan question, but just overall in general, what grade would you give our leaders about how they've handled this crisis from the very beginning?
Yeah. So, that's a very challenging question because the way we structure our government in the U.S., it's a federalist system, which means we have the federal government, the state government, and local government, right? They're all involved. And unfortunately, since the beginning of this pandemic, we've had different messages coming from the different levels of government. And we've had different messages even coming from the CDC, the federal level itself, right? So some of it is because the science has changed. Early on, people didn't think masking was necessary or important, and they discouraged masking. And then the science became clear, and so they changed that message. But that's very confusing for people, right? So I think part of our challenge has been that you have different messages coming out from different branches of government. And it is so important, because this is a complex message, it's so important that these branches of government work together. We need a consistent and common message from the federal level, from the Centers of Disease Control, to the state level. We need the governor and we need the legislature to be giving the same messages, and we need local public health to be giving the same messages. And unfortunately, that has not always happened.
Yeah, I think that's been such a key issue in this entire pandemic and we understand the science changed. And as the science changes, then the recommendations change as well. But it's like you said, you're getting so many different messages from so many different arenas. It makes it hard for the public to kind of grasp just the severity from the very beginning of this pandemic and what we've been through. And knowing that going forward, do you think there will be any long-term benefit out of this crisis for our public health or our healthcare industry?
Yeah, well, that is the hope. And I think we've learned an awful lot about our healthcare system. We learned an awful lot about public health. I mean, as a public health professional, I'm pretty excited that people even know what public health is now, right? Because they didn't for a long time. In the US right now, 3% of our total healthcare spending goes to public health, 3%. And I think people now value public health. And so I am hopeful that we will have more funding coming to public health. We'll be better prepared for the future. This is unfortunately not going to be our only pandemic. There are a lot of things happening globally that give us the signals that there are others that will come down the road in the future. And I think we've learned a lot from this. I think we will invest more in public health. I am pretty optimistic about what I'm seeing coming out of the new Biden administration about re-envisioning the Centers for Disease Control. We need a stronger voice at the federal level for public health and a more consistent voice. And I think some of the leaders that are being talked about for that role will be very important going forward. I'm hopeful that we've learned that the medical care system and public health need to partner together. And that's not always been true in the past. And I'm hopeful, since I've spent a lot of time looking at nursing homes, we really need to think about our whole long-term care system and how seniors age in our country. And we need to, there's some really promising ideas that are out there. There's some really innovative things that are happening for seniors to help create a healthier environment and to really rethink how we finance nursing home and long-term care. So I'm hopeful on those aspects. I think there's a lot we've learned here, and I am optimistic about the future. We just have to get there first.
Right, but sometimes in the middle of a crisis, we do switch how we operate. But once that crisis is over, people and organizations tend to go back to what they knew. And how they used to do things. And especially in the nursing homes, we hope that doesn't happen. But in knowing that, where do you think public health is going to stand in trying to make those changes permanent? I do think I'm hopeful that we will have that conversation. You're absolutely right. We have a danger of falling into being lulled back into, we can just go back to the way we did things before and there won't be any change. But this has been such a dramatic impact on so many people, and I'm hearing conversations that I haven't heard before, and I'm hearing, it'll depend on whether we have the public will to make the change, whether whether frankly Congress can work, and we do need, and whether our legislature and the governor can work together. We do need to be looking at some fundamental things. We do need to be investing in reducing race equity, addressing those issues where we've had such inequities in our communities. So, I think certain things will change. For example, telemedicine, telehealth has ballooned in the middle of COVID, and people have learned that we can do more things online and that can help more people. I don't think we're going to go back to the old ways of delivering medical care. I think we've learned new ways to deliver medical care. I think there will be much more interest in enabling seniors to age in their homes and providing supportive services in communities to enable people to stay out of nursing homes. So I think there are really some promising things here that we won't necessarily go back, but it is a danger. And we're just going to have to see if we have the political will to make it happen. Well, let's hope that that is the positive that comes out of all of this. Like you said, it definitely opened up the conversation on a national platform about the race inequities within our healthcare system. So let's hope that conversation continues as well. Marianne Udow-Phillips with us on the Oakland County Megacast. She's the director for the Center for Health and Research Transformation. Thank you so much for taking time to be with us on this Monday morning.
Great to be with you. Thanks, Ronnie.
Thank you for the insight. We're going to take a quick break here on the Oakland County Megacast. And when we come back, a lot to get to in the second hour of the Megacast. Next up, we'll be speaking with the co-state policy advocate for the National Council of Jewish Women about the work that they're doing surrounding our vote and our voice. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services. Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Just another hour left with us here on the Oakland County Megacast. As a reminder, you're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. And also, Tyler and I are here Monday through Friday, 10 a.m. to noon. You can watch and listen to us on civiccentertv.com, Birmingham Area Municipal Access. And if you have cable, check us out, channel 15. If you have Comcast, channel 99 on AT&T. We also want to say thank you to the Greater West Bloomfield Chamber of Commerce for allowing us to live stream today's edition of the Oakland County Megacast on their Facebook page. They're always a great partner of us here at the Megacast, as well as Civic Center TV. Our next guest, kicking off the 11 o'clock hour here on the Megacast, Irma Glacier. She is the co-state policy advocate for the National Council on Jewish Women. Thank you so much for being with us here on the Oakland County Megacast.
You're quite welcome. I'm happy to be here.
We're about 3 weeks out from the election, but still it's in the headlines. Your take on how this past election went?
Well, I'm not going to go into too much detail on that because the polls really were so strange. We thought we were going to be doing one thing and things came out differently, and the future seems very uncertain to us. So when we started with these webinars and this webinar is what I'm going to be talking about today. When we started with those, we called it the power of your vote. And we had a series of 3 webinars. The first one was meeting the candidates, and that was for state legislators, and that was quite important to us. And then the second one had to do with the election itself and protecting it, protecting the Michigan election. And we had Jocelyn Benson, the state Secretary of State. We had Lisa Brown, who is the Oakland County clerk, and we had the West Bloomfield Township clerk, Debbie Binder. And that was a powerhouse of a webinar in terms of the safety of the mail and so on. And now the third one, which at the original time of planning, we sort of thought that was going to be a little bit too late. Everybody was going to be coming in with their prediction, with their pundits at the right after the election. But it's turning out to be a really good time, I think. This webinar that we're going to have, which is post-election reflections, implications for the future, is going to feature two people from very diverse viewpoints as far as we're concerned. And things have been so fluid in the past 3 weeks. We don't know from day to day what issue we really want to concentrate on. And I think that it's just been a very uncertain time. And I don't know that by the 3rd, which is just a couple of days from now, that we're not going to have something else that's going to raise its head. And we may have to shift our focus. But in the meantime, we have Brian Dickerson from the Detroit Free Press, and we have Nolan Finley from the Detroit News, who are coming to talk about what they think about what happened with the election and what's going to be happening in our future.
It has definitely been a crazy election cycle, one that we have never experienced in recent memory. But I think the one thing it did do was it really pushed so many people that maybe didn't vote before to get out and actually exercise their right to vote and to have their voices heard. So from that standpoint, a little bit of positivity that came out of this crazy election cycle.
Well, I'd like to talk about that because my organization isn't known quite the same as a public health organization or as Gleaners Food Bank, but our organization is dedicated toward, and our mission statement really is, for improving the lives of women, families, and children. And so we've had to shift with the times. We started 129 years ago. Not I, by the way, not 129 years, but close. At any rate, when we started our organization, our first thing was an education assistance scholarship, just one. And that has grown into about 140 a year that we give for students to go to college or to continue in medical school. So that's how it started. And then later on, we went into penny lunches. But then they had the free lunch program, and so we had to put that aside. Then we met the immigrants from the boats when they came over here, and we helped them to adjust with literacy. And of course, that's not something that we have to do anymore for the immigrants. But what we do is a literacy program in Detroit. We've tried to help in so many different ways, but advocacy has always been a prime objective of National Council of Jewish Women. And with this election, we decided that there were so many issues for women, for families, for children that were not being addressed, that we needed to focus something for the November 3rd election. And what we did is we mounted a campaign for getting young people to vote. So when you're asking about the election and so on, this is where we worked. We worked on trying to get young people to vote because the number of youngsters who were voting was pitiful. It was really such a small percentage. And whether it's because they were just so busy with school or starting a new job or whatever was happening, they just were not being motivated. But different things have been happening in the past so many years that have made the job a little easier in terms of getting them interested. And we started first with a form that we developed, sending it out to college students to get them to register and to vote. And then we expanded it to something called Let's Both Vote, where we involved our members and our coalition members in calling their loved ones and asking if they had registered and asking if they had voted. And this was a very good way of involving our members and our coalition members in doing this. And then we decided to develop the webinar idea to see just, afterward, to get people involved, not just the young, but the community in general. So I hope that answers what you were asking. Mm-hmm.
Yeah, a little bit different year, though. Typically a lot of the get out to vote efforts would be made door to door or at big public events, so you can reach a lot of people at one time. But you're also trying to do this in the middle of a pandemic when we're being told not to socially isolate. So how is that for you and your members?
Well, that was an interesting thing. For our members, it was a rather easy thing to do because remember that ours was an outreach to loved ones. So that made it a little easier. I agree that making phone calls, we've been asked to do phone banks and so on. That just doesn't work in a pandemic. People just don't answer the phone. In fact, if it's not a pandemic, people don't answer the phone. They're screening their phones, and this is a problem. And going door to door, I think would be very risky, and I really wouldn't expect people to be doing that. So ours was not a door-to-door campaign. But we've been involved in campaigns where we have gone door-to-door, and we have done petition drives. Our organization was in the coalition with voters, not politicians, and we worked very hard on gerrymandering. And also, because we're very involved with equal pay for women, pay equity, we have worked very hard on minimum wage and on the earned sick time, because that's important too.
So Irma, with that, any effort that's being done by you and some of your members and volunteers to also maybe get more women involved in the elected process, to get them in office?
I think it's been very interesting that it wasn't just the pandemic. It has been since 2016 where people have been more awake as to what they can do. When we were working on the gerrymandering thing, we were surprised at the number of people who wanted to be trained to work with petitions and so on. These were all unpaid people, to get people to stand out in all kinds of weather, in all kinds of places, and maybe not always having a good response, although I think we got terrific responses, but, occasionally you get somebody who's argumentative. I think that was fabulous, and I think women are becoming more assertive that way, and it is important.
Irma Glaser with us here on the Oakland County Megacast. She's the co-state policy advocate for the National Council of Jewish Women here in the state of Michigan. I know that part of your job and your effort is to lobby our elected leaders in Lansing. How has that been during the middle of COVID, when so many of them aren't really in Lansing right now? We're all doing remote work.
That's a good question. And actually, before we go to that, I just want to mention, yes, we do lobby, but we are, just as your last guest mentioned, we are a nonpartisan 501c3 organization. So we do not advocate for people, for one party or another. What we advocate are for our issues. And so I've been writing letters that have been in the paper. Other people have been writing letters that are getting in the paper, and we hope we get that gets the attention. We have called our legislators on various issues, and in that way we have attempted to make contact. It's not easy, and you usually get a form letter answer from some people, but hopefully they're listening, and we've invited them. That was one of the reasons we had the first webinar, to meet our candidates. Some of them were all state legislators, and some of them were running for re-election. So that is important that they come and state their views. Whether you agree or disagree with the views didn't make a difference. But we tried our best to maintain our position on the issues that were important to us.
And with that, I felt like on a state level and even on a local level, the attack ads this year were they were crazy. I mean, every time you turned on the TV, there was some type of attack ad. How hard does that make your job and that of your members to try to get out accurate information on all of the candidates?
That's an interesting thing, because I just read something recently, and I think it is true. The more you hear the attack ads and the more you hear the lies, you hear them over and over again, the more they become the truth. And the things that are true tend to be in the background. It's almost as if negativity and anger and almost slander are the things that are more important to people, because they just hear it over and over again. It's amazing. I wish I could answer that question. I really do. One of the things that we're going to be addressing in the webinar on Thursday at 7 o'clock has to do with the media and the media's position in helping us to kind of root out what is true and what is not true. The biggest problem that I see that we've run into is the lack of print anymore. The newspapers, they're coming down to nothing. We used to get investigative reporters who really dug in deeply, and we still get a little bit of that, but not as much as we did. We used to get things in magazines that could help us to understand things better, but the magazines now seem to come late. They seem to come after the fact because things are changing so quickly. And so one of the areas we're going to be talking about are the implications for media down the road, and what part did they play in the November 3rd election in terms of, were they timely in making their endorsements, and were they timely in telling us about those proposals that were on the ballot, which I think a lot of us don't always understand these proposals, because they seem to be couched in language that you really almost have to be a Philadelphia lawyer to know what's going on. Is there such a thing as a Philadelphia lawyer anymore? Maybe not.
But you bring up a very good point, and one that has been discussed in media circles for at least the past 10 years, because it was pretty much known that investigative journalism was going away. Print has been going away. One thing that has emerged, social media and the use of social media. And while it can be helpful, it can also be hurtful. How are you, members of you and your organization, using social media to get out your message and rally around some of these issues that you find dear to your heart?
Well, you know, I told you we were 129 years old, so we used to use Pony Express and homing pigeons at one time. But now we have to be more serious about it. And sometimes I think that when we buy ads in different areas, it's not as effective as it should be. Word of mouth is almost better. But I think that we have to think in terms of the social media and hope that people are looking up our contacts, whether it's YouTube or Instagram, Twitter, or whatever it's going to be, because I don't know, maybe next week there'll be something different that we need to use. They're less expensive. People seem to be on their phones and on their computers all the time now. And those may be gone too, for who knows. We may have something different coming down the pipe. But there's no question that there's been some shocks that go on. And that's what I wonder about polling. When I mentioned polling before, it was such a not really a surprise, because it's been going on now for the past few years that the polls are wrong. So should we have polls, or is there something different? And why should people be ashamed to say something at a poll? They say some people don't want to admit whatever they are. Or is it because we're using telephones and nobody answers the phones, and so maybe we only have 5 people answering? These are questions that concern me. I just wonder, where are we going to be getting? So we have to get our message out with the social media. And I have to admit, that is one area that we've been rather remiss in my organization, but we are working hard to make up for that. We've updated our website, and I'm going to tell people that they can go to our website for sure for the webinar at www.ncjw.org, and they can register for the webinar. But I wanted to talk a little bit more about other things that we have done. You know, things do change, and I'm hoping that there will be changes for women, family, and children, for everybody, really. We need change. We need change. But we started the Orchards, which is the Orchards Children's Services now. And it started in a little house with 6 boys. And now it is, I think it's the largest foster care and adoption agency in the state of Michigan. And we're very proud of that. But we no longer take care of it because it's too big. We work with meals, our kosher Meals on Wheels, we started years and years ago, and it's been very successful. And then our numbers started going down. And that was the reason that people were going into assisted living and so on. But during this pandemic, the change has come again. The rise in people needing it who are in their homes, Meals on Wheels. So that's another thing that we've done. And we also spent a number of years creating the All Kids Playground in Waterford, where children of all abilities can play together. So what it is it's a playground that's safe for disabled children, but children who don't have physical disabilities or mental disabilities can come there too. And that's a chance for them to interact together. Perhaps we need an all-people's playground where we can talk together about these issues that are so important to us, things that disturb me and worry me about the future of our country. And I'm hoping that we'll hear some areas of agreement on Thursday. I think we will. Actually, I do think we will, because I've seen some things. I read the papers, such as they are, what's left. I do read the papers pretty faithfully. And I do see some areas where there's agreement. And when we're not so worried about trying to make sure that my opinion is heard and no one else's, and if we really listen, I think we could find some areas. I'm hoping that that's what Thursday will do. I'm hoping that there are people who will tune in, who will listen carefully, and who cannot talk back because only the panelists can talk. And we'll see that we do have a lot of places where we can work together. Certainly for education, certainly for, there shouldn't be hungry people. There should not be. Do you know that one of our programs, which we could not do this year, was the Back to School store that was in Detroit. And that was letting children get the right kind of clothes and school supplies and so on. And this year, because we couldn't really do this, we gave out coats through the social agencies. We also had backpacks for Oakland County. And I want to tell you something about that. The backpacks that we packed for years, for the past maybe 5 or 6 years, maybe a little longer. Yeah, longer than that. I think we've done it for about 10 years. And we give out about 1,200 of those a year. They went to homeless children in Oakland County. And do you know that there are over 9,000 homeless children, most of whom were 9 years or of age or younger? That's startling. We should not have people who need food, as our Gleaners person talked about this morning. And we should not have people that don't have proper clothing and proper supplies for school. These things are terrible. This is not what a country like the United States should have or be proud to have. It's terrible. So those are the things that concern me. Our literacy program in Detroit has actually worked pretty well. We're at the Coleman Young School. It's an elementary, and it's a school that needs tutoring, and our members have gone there faithfully and tutored, and we've found that we've had a little bit of an increase in things. But none of us should want to have children who grow up not being able to read or write or do math or do whatever. These are the minimal things that we should have. So I'm hoping that we can find areas of agreement where we stop fighting one another. And on the medical issue, the same thing. No one should be denied medical care and adequate medical care because they don't have the money.
That is so true. Irma Glaser with us here on the Oakland County Megacast. Let's hope the one thing that came out of this pandemic was our communities coming together to reach out and to help one another. We'd like to see more of that in 2021. We thank you for your time here on the Oakland County Megacast. Just as another reminder, the free webinar is going to be Thursday, December 3rd at 7 p.m. Irma, thank you so much for your time.
I've enjoyed it very much, and I've enjoyed your guests beforehand too. They were very informative. Thank you.
They were great. I always say I learn something new every day on this show.
And I did too.
Well, great. Well, thank you and good luck with your webinar. We appreciate your passion and your time as well.
You're welcome.
We're going to take a quick break here on the Oakland County Megacast. When we come back, Annabelle Cohen with us. She is going to tell us what we could do with those leftovers if you still have them. I don't even know, is it safe to still have leftovers in the refrigerator? But also get us ready for the upcoming December baking season. This is the Oakland County Megacast.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Just about 30 minutes or so left here on the Oakland County Megacast. It's been 4 days since Thanksgiving. And I think that we were like so many other people, and due to the limitations on household gatherings, we made Thanksgiving dinner here for the first time ourselves. But what does that mean? That means we have a ton of food still left over. But I'm always confused. When do you need to throw it out? Joining us now is Annabelle Cohen from Annabelle Cohen Cooks Detroit. You're also a food and lifestyle writer, a cooking instructor. Annabelle, I've known you since my Fox 2 producing days, like what, 1998, 1999?
You were a child. You were a little child, very, very advanced for your years.
But you always have given such great advice. So when it comes to food, and the fact that it's, 20 plus years later, and I'm just now cooking Thanksgiving dinner for the first time, when do you throw it out?
Well, it depends. If you haven't done anything with it, like put it in the freezer, then you should, after 3 days or so, it's a shame to throw anything out. But what people have done this year, because it's hard to find a turkey that's under 10 pounds and you're only serving sometimes 2 people with it. So what people have done is they've frozen a lot of their leftovers. And that's great, because if you've frozen them, you can use them for another month, which is fantastic. If they're still sitting in your fridge, it depends. Cranberry sauce is good for, probably 6 weeks in your fridge if it's full of sugar and natural preservatives like that. But the problem with leftovers after a few days, you don't want them. And so if you still have some, and they still could be okay, because chances are they weren't sitting out for hours and hours, because we didn't have those big Thanksgiving buffets where the food would be out for an hour or more while people ate it and went back for seconds and thirds and fourths. So if you still have some, what a really fun thing to do, and if you've frozen stuff, great, pull it out of the freezer and use it, is to put the turkey and the stuffing, add an egg or two, and put it in a waffle iron and make Thanksgiving waffles, stuffing waffles, which are really yummy. And then you can serve them with a cranberry sauce. It's just a different take. And because it looks different, somehow it kind of tastes different too. So it's not a bad idea to do something like that, stuffing waffles. If you have turkey and it's your freezer, great. If you still have that carcass in your fridge, it might still be good. But the best thing to do is put it in your crock pot or Instant Pot or whatever, boil up that turkey carcass and make a soup out of it. Or chop up those turkey pieces that you don't like. Some people only eat the breast meat, some people only eat the dark meat. Chop up whatever's left and make a nice chili out of it. Add a can of beans and some spices and a can of diced tomatoes, and you've got a wonderful chili. So there's still things you can do with it. The first day or two after Thanksgiving, we eat the leftovers because we seldom eat turkey and stuffing during the year. So we still are really in love with it. But after yesterday, which was the 3rd day, and today, which is actually the 4th day, we have to reinvent it completely. Otherwise, it's just not good. And really after today, if it's still in its original form, unfortunately, it's probably not a good idea to keep eating it.
I did make a turkey pot pie yesterday.
Oh, good. Frozen peas?
Yes.
That's great.
Pinterest has saved me this Thanksgiving.
Yeah. But I don't know that how much turkey can one eat? It's terrible to actually throw anything away, but sometimes it's not even safe to eat it after a few days.
Yeah, because isn't that saying, when in doubt, throw it out?
When in doubt, throw it out. But if it smells good and tastes good, and if you boil it up like in a chili, something that you're cooking for a long time, or a soup with lots of water and really boiling it, chances are it's still safe. but a lot of people froze. A lot of people love leftovers. I'm not a leftover gal, so I tend to give everything away. But I have a sister who she'll freeze 2 ounces of steak and make a whole meal out of it with it the next day. So that if you still have it because it's frozen, fantastic.
Yeah, I'm not a leftover person either. I'm like, nope, get rid of it. Let's move on. Knowing that, though, obviously the focus now is shifting to the holidays coming up. So baking is a big thing. And I think, it's snowing today. It kind of starts to put you in the mood. So when is it too early to start baking?
Never too early to start baking because we have a friend in the freezer. And what's best if you can pull this off is you can make all the cookie dough you want, but don't bake it yet. Bake it as needed. Put it in perhaps zipper style bags or storage containers. Put it in smaller portions in your freezer. And then when you need those 24 cookies, just pull the dough out at, an hour or so before so it can defrost and make those cookies right then and there. Some cookies have a really long shelf life. Sugar cookies, the kind that you make with butter or shortening that you roll out and decorate, those have a huge shelf life. I once found a cookie under my car seat 6 months later, a decorated cookie. I'm telling you, I ate it and it was delicious. So, but it is never too early. Some things freeze really well. Brownies freeze great. Anything that's really dense or has a lot of other ingredients in it. But some things don't freeze so awfully well. But you can bake at any time. You can bake. You can even put those tins if you have room in your freezer. Right now, this time of the year, it's snowing, right? It's cold. The garage is a refrigerator if you have a garage, and as long as it's under 40 degrees in your garage, you can store those cookies, and it'll just make the shelf life a little bit longer.
That is a great suggestion because we have one of those split refrigerator freezers, and you can't fit anything, right? You're like, oh my gosh.
Yeah, they're really small. Yeah, and those freezers are small too because we've got all those Thanksgiving leftovers in them. So if you want to avoid using the freezer, of course, you can use your garage this time of the year to store certain things. You're not going to store, regular food that you're going to eat because the garage is warmer than the outside temperature because we have that big door and we have the house next to it that's emitting some heat through the walls. But think of your garage as an extra storage space. And again, cookies have a really long shelf life. And so do things like pie. Pie you can keep for days unrefrigerated even. I don't know if anyone's going to think it's unsafe, but I recall in my youth, I'm not that old, but I remember people had antiques. Let's call them antiques. And they were pie safes. And they were usually a cupboard that had like tin punched doors, and people would keep their pies in those, they called them pie safes. And for days and days. I mean, some pies, like pecan pie, can stay out a lot longer than a fruit pie, but you have to get a little bit clever this time of the year. You can also, you could go to a place like one of the hardware stores and buy a freezer for less than $200 and put it in your garage. It's one of those chest freezers, not very big, but you don't need a whole lot of room. And that's a fun thing to have in the winter for storing things if you need to. And it's fun to have in the summer because you put it outside in your backyard and plug it in and put ice cream treats for your guests if we ever have guests again.
Right. And speaking of that, I wonder about you because you do catering as well. What has this pandemic and this latest pause meant for you and your catering team? Because normally this time everyone's having huge holiday parties. I mean, they typically start like this next week. Well, that's not happening now.
The huge parties, which are, I'm saying over, not today, these days, huge is 12, but the big parties, 50, 100 people, they're canceled. But we're also doing other things. We're doing Zoom cooking classes, which is fun, where everybody has the same ingredients and we all cook together for the holidays. A lot of offices are getting very creative. I have one office where we are picking up the groceries and putting them in cute little bags and sending out a big cutting board and whatever we need. And employees are picking them up at the office, or they're being delivered to the homes, and we're all cooking together with the same ingredients. We're doing it. One class I have coming up next week is going to be to make, instead of a gingerbread house, a charcuterie house. So it's a charcuterie, and everybody's getting a really cool Etsy kind of cutting board that the company owners have sent to everybody. It'll be their gift. And we're going to be doing this fun class where we're all putting it together. And it's really fun because if I'm telling you, Ronnie, if I gave 10 people the same recipe for spaghetti sauce, we'd have 10 different spaghetti sauces. Everybody has their own take. And that's what's really, really fun about cooking it yourself, is that some people don't like certain ingredients. They can leave them out. They can add in the ingredients they want. There's all kinds of things that they can do. So people are getting sort of creative. And let me tell you, when you're doing things on Zoom, it's a lot less expensive than actually taking people out and feeding and drinking them or catering something in to do it something on Zoom, and you can give them like an extra special gift or maybe pad the paychecks a little bit. But it's bad for people like me because this is my busy time of the year, the holidays. I make a lot of money during the holidays usually, and instead of doing a lot smaller events. But somehow it all works out. We're just hanging in there until most of this goes away and we can really have a lot of fun with more people.
I will say to the company and the bosses that came up with that, the Zoom cooking class,
yeah,
super smart. I mean, plus I feel like people will maybe even enjoy it a little bit more because they get something out of it, but also, they're learning something new.
Yeah. A lot of people love the holiday party, but a lot of people would rather not go, but feel like they have to go. And this way they're going and they're learning something, and then they have a cool gift at the end, and it's something they can do a week later for their own family and friends.
But with that, what about your staff that you typically hire?
I feel so bad. I feel bad for the staff. The staff is, a lot of the staff is out of work. Some of them, it's not their only job. It's some sort of moonlighting, but the staff, nobody, no secret that the food service industry is really, really suffering, and they're suffering too. It's their income. It's people want to. It's not about buying presents for their family, which they want to do as well, but they need the money. Everyone's living lean these days, very lean.
Yeah, and so with that,
I'm not buying a whole lot either.
Yeah, we learn what we can do without, right?
We can do without almost anything. Yeah, we can do with almost everything. I moved recently, and for the last month of my living in my house, I had a plate, a bowl, a fork, a spoon, and a knife, and I used it every day, every meal, and it was just enough.
That's funny coming from you, someone who cooks,
Service for 100, so yeah.
So
do very little.
With that, Annabelle, what do you think you learned during this crisis that is going to be a benefit for you and your business going forward that maybe will stick around?
Well, you hit the nail on the head, is doing with less. I mean, I remember when we had the economic crisis in 2008, 2009, Time Magazine wrote a whole article about how people are living with less, and it's probably better for us because we're so spoiled by living with so much. I literally have service for 200 dishes. I've got maybe 8 different sets of silverware. Who needs all that? And that's personal stuff, not catering. I lived with a spoon, a fork, a bowl, and a plate for a whole month.
Wow. And with that, talk a little bit, if you can, the use of social media and Zoom and the internet to keep your business afloat.
It's been great. I've been doing a lot of cooking classes, and some of them I donate some of the proceeds to charity, which is good for me. It's good for the charity. And people are willing to listen in or perhaps join up if they know that some of the proceeds are going to a good cause. But you know what? We are very social people, so we still want to have a party every once in a while. And you can do that too. I did the food for a story. I didn't write the story for Black magazine. I don't know if you've ever heard of it, BLAC. It's a Detroit magazine, and it's about social distance holiday parties. And a lot of people take the temperature, they wear the masks, they only take the masks off for eating. And then you can still have, 6 people at your house. And sometimes 6 is just enough because everybody can sit around the table and you can, or sit on a sofa or 2, and you can, or 2 on the sofa, 2 at the table, or 2 in the other room for the most part. And then have a party and still have foods that you can eat that are safe. I just did a party recently, an engagement party, and it was very small. And we did all pickup foods. And when I say pickup, I don't mean things on a stick necessarily, although we had lots of things on sticks. But you could do individual bowls of macaroni and cheese. And so people aren't picking up a spoon and digging it into the macaroni and cheese. They're getting their own little bowl of macaroni and cheese, or they're getting their own chicken kebab on a stick. And they can eat and they can keep going back, but they're not actually touching anything other than what they're already using. In fact, I sent some photos. I don't know if they're going to be available, but there's some photos of a party recently where I did exactly that, and it was fantastic. And so the key to holiday entertaining, if you're going to have anybody, and again, I'm not advising anybody to have anybody, but even if you have yourselves, there's no reason you can't do the best just for you, and have little parties for yourself. Another thing that people are doing, this just reminded me talking about this, is that, and they did this for Thanksgiving, somebody would make the meal. And people would come by the house and pick up their meal on the porch, and they take it home and they'd all eat together. That's another fun way to entertain for the holidays or any time if you want to see people. Not that you need the food to entertain, although in my book you always need food to entertain because food really brings people together. And it's like reading the same book. You're all eating the same meal, so that's kind of fun. And that's another great way to entertain if you want to for the holidays.
I love that. And if anything, it's forcing some of us that don't cook to learn how to cook, but also
experts.
Yeah, and food does bring us together. We're just looking at it at a different way. Hey, Annabelle, if someone wants to join in on one of your cooking classes, are they open to the public, or how do you work that?
All my classes are private. If you can get 8 people together, you can have your own class, which is very fun. I'll give you a shopping list. I'll give you an equipment list. I'll give it to you ahead of time so you can have it all ready and we could all cook together. And what's nice about it, if you have, again, at least 8, otherwise it's just not, financially, it's not worth it for me. I love to cook and I love to cook with my friends, but unfortunately I have to pay my bills as well. So 8 is kind of a bottom number. And what's nice about that is that I can watch you and you can watch me and I can tell you what you're doing right and show other people all these great things that you're doing. Or I can help you move along if you're not such an advanced cook. And even the most advanced cooks I learn things every day. You mentioned it earlier when you were speaking to your previous guest, how you learn things every single day. So do I. And I like to pass those on to people. And sometimes when you see a recipe, I'm doing actually 2 classes this week. When you see a recipe, a lot of times I think I'm giving you all the information, but maybe not all the information that you necessarily need. Maybe a better way to peel a potato, or an easier way to cut garlic, or ways of measuring food without using a measuring cup. That's always really fun as well. For example, my hand, I'm not a tall person, but my hand looks huge here. Look how big my hand looks. But I know that my hand can hold a half a cup of almost anything. Rice, vegetables, onions, or anything. My hand, that's a quarter. So I know that's my measure. I measured my hand. You're a tall girl, Ronnie. I bet you have a bigger hand than I do. I always joke that I'm 5'2" both ways. You can grab a handful of any sort of a vegetable or rice I need it, and I know that that's a half a cup approximately, and I can add it to whatever I'm cooking. Now, when you bake, you have to be much more precise because there's all kinds of chemical reactions, and you can't put a half a cup of baking soda in anything, but you can when you're cooking, which is much less precise, then you can measure in different ways like that. That's one tip that I can give to people. Take a handful of something, put it in a measuring cup, and you'll know how big your hand is, how much your hand will hold.
Well, that's a good tip to leave on. Annabelle Cohen with us here on the Oakland County Megacast. She's the owner of Annabelle Cohen Cooks Detroit. You're also a food and lifestyle writer and cooking instructor. You pretty much do it all in the world of cooking, and it's always great having you on with us. And Annabelle, we wish you and your team the best of luck in
so much.
managing this pandemic, and we hope you get through it.
Thank you very, very much.
Okay, we'll talk to you again soon. Thank you so much, and happy holidays.
On New Year's, Christmas, Hanukkah, whatever you say.
Exactly.
Everything. We need all the happiness we can get.
That is true. We're going to take a quick break here on the Oakland County Megacast. And when we come back, we'll round out the show talking a little bit about how COVID-19 and this pandemic is impacting our governments, and are they going to have to change the way they operate? This is the Oakland County Megacast.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Tyler, where does the time go? Just about 15 minutes left in the Monday edition of the Oakland County Megacast. Just as a reminder, you can catch Tyler and I Monday through Friday, 10 a.m. to noon. Listen to us, watch us, civiccentertv.com, Birmingham Area Municipal Access. If you have cable, you can tune us in. If you're channel surfing at home, channel 15 on Comcast, channel 99 on AT&T, and you can also tune us into the radio, 89.3 Lakes FM, 88.1 FM The Biff. And we also want to say thank you today to the Greater West Bloomfield Chamber of Commerce for allowing us to live stream the Monday edition of the Oakland County Megacast on their Facebook page. Rounding out the show today, just about 14 minutes left in the show, we want to go ahead and bring Bill Anderson into our conversation. He's a specialist on local government finance and operations with the Southeast Michigan Council of Governments, SIMCOG as it's known. Bill, thank you for being with us here on the Megacast.
It's a pleasure.
We are 8 months into this pandemic, and I think that you are a person who is definitely a need right now for so many of our local governments, because how is the overall impact of COVID-19 and this pandemic and this crisis? What is going to be the overall impact on our local governments?
Well, you know, SEMCOG is a regional planning organization, and our focus is on transportation issues. But, you know, one of the things you have to do when you're going to invest billions of dollars in roads, you need to know how the economy works, you know, what are the demographics of the region. And as we have seen COVID-19 become this reality that's ingraining itself into the economy, you know, what we're starting to do is starting to ask questions. Well, what is the economy going to look like when this is all said and done? You know, we go out onto the roads today and we notice there's a lot fewer cars out on the roads because so many of us are sitting here on Zoom doing our work at home. And that has an impact on what's going on. But when we look at the long-term impacts of COVID-19, I'll use as an example, my mother is in an independent living facility. And of course, they've been locked into their apartments for a while, since April. They're not doing congregate meals and those kinds of things. Well, what's this going to mean for the future? And for instance, how we build these kinds of facilities? Back in the year 2000, we had twice as many kids under the age of 18 as we had people over the age of 65. Within 5 years, by 2025, that number in our region, within the 7-county region of SEMCOG, is going to be equal. There's going to be as many seniors as there are kids in our region. By 2045, we're going to have 3 times as many people age 85 or older. Can you imagine what COVID-19 would be like if we had 3 times as many truly elderly, vulnerable people? Well, some of the things that we may be looking at are, for instance, when we build, independent living facilities and nursing homes. I look at my mother's, and it didn't dawn on me until this was going on. All of her heating and air conditioning comes directly from outside in her apartment. So she has her own furnace, her own air conditioner that brings the air in. Now, as a son, I'm thinking that's a real good thing, because if there's any COVID virus around, at least that's not circulating into her apartment from the rest of the building. So it's simple little things like that that are going to be happening. But on a broader scale, when we look at what the business community is going to be like, and we look at, say, office buildings, what are offices going to be like in the future? We have a lot of office space, Troy, Bloomfield, downtown Detroit, Southfield, but a lot of companies are not going to be bringing all those white-collar workers back into the office when COVID-19 gets done. So now we have to look at things like internet connections, making sure that we really beef up the internet, because so many people are going to continue to work from home even once COVID-19 changes. It also changes, where are we going to live in the future? Now it may not be as important to live within 15 miles of your workplace or within 15 minutes of your workplace. You may be 2 hours away from your workplace because you only go there a couple times a month.
Yeah, think about 75, the construction on I-75. How many multi-millions of dollars of taxpayer dollar is going in to that freeway to widen it? And now you're not going to have the traffic coming and going on 75 on that stretch.
And these are some of the things, when we plan, for instance, we just adopted the 2045 plan. We are looking at the needs of our region in 2045, because when you're looking at things like roads, you have to plan that far in the future. But now you have to kind of take a step back and saying, we had some real basic assumptions, and the world changed 8 months ago. And the chairperson of the Fed said, you know what, our economy has changed forever because of this. And so, yeah, we have to step back and start saying, what will, our economy look like in 2045 or 2050 when we begin work on the new plan? And where are people going to be working? How are they going to commute? What times do they commute? We build our roads based on the fact that we have a rush hour in the morning and the afternoon. Well, that can change. We have maps. If anybody ever wants to see some interesting maps, go to semcog.org. And for instance, we have a map that has every building within 7 counties on the map, listing when it was built, square footage, all the basics of it, all the commercial buildings. Is it a retail building? Is it an office building? How many square feet is it? we need all that information to try and figure out where people are commuting from. We know this many employees have to go into Troy every morning. So we have to, we have the world's greatest computer program, the biggest SimCity program you've ever seen, to figure out where everybody literally goes every day. That's changing. And that has a change for road usage, for sewer and water, for broadband basics. These are all basic issues that governments are going to have to deal with.
Yeah, and on top of that, how long will it be before people are comfortable going back to a Lions game or a concert at Ford Field? I think we're looking at a few years out before we start to see that our pre-normal, as people like to call it, before we get back to that comfort level.
And it's other things too, like for instance, childcare. Everybody is dealing with kids at home, no daycares open because of concerns over COVID. But, in some ways, it also makes us understand those with low incomes that are raising families, the challenges that they've had, where it's not because they don't necessarily have daycare, they can't afford daycare. And now you understand the struggle when you're trying to work your way beyond poverty. When you have a family, you have to balance this issue of, I don't have daycare for my kids, how can I go to my job? Well, now it's not just a low income kind of issue, it's an everyday occurrence for anybody with a family. So we're really learning about that, and maybe it's going to give us more insight to better deal with that in the future.
Bill Anderson with us here on the Oakland County Megacast. He's the specialist on local government finance and operations for the Southeast Michigan Council of Governments. Bill, just about 2 more minutes with you here on the Oakland County Megacast. What do you want the listeners and the viewers to know about you and your team and the work that you're doing and how you've had to shift what you're doing during this time?
As the regional planning agency, we bring in local government officials from across 7 counties: Wayne, Oakland, Cohen, Livingston, St. Clair, Washtenaw, and Monroe County. We've had to go to a completely virtual environment. We work from home. Normally our office, we could have been watching the Thanksgiving Day parade because it's right on Woodward in downtown Detroit. But with concerns, we're lucky that we had the technology that we could literally within a week shift into a completely virtual mode. But we're like everybody else, we've got numerous people with families that during the workday, they're watching their 7-year-old, on their computer as they're taking their computer classes while they're trying to work. So what we are looking at is trying to understand how is the world changing, and trying to make sure that all those local government officials that we work with are going to be better prepared in the future to make sure that we can adapt to the new reality, and also to hopefully be better prepared should something like this occur again in the future.
Yeah, because as you said, you're making plans for 40 years out, 20, 25 years out, makes it, you don't have a crystal ball. So it can make it a little hard for you and your team and our elected leaders to also navigate this crisis and the future of this crisis.
Yeah, it really is, what is the new reality? And as you said, how do we get people back to work? How do we get, all the numbers are showing the hardest hit group is working mothers because they have to deal with kids at home and then trying to maintain a job. That's a major issue within the economy. And we all have to try and figure out how this economy is going to function in the future. And there's going to be some really good things that come out of this. And we're going to have to identify some real holes to fill besides potholes.
Well, we have plenty of those, although I will say one thing that could be the positive for the state of Michigan, not as many people driving, which means a little bit less wear and tear on the roadways, which could mean fewer potholes.
And less revenue coming in from the gas tax to fill the potholes.
See, there's always so many different angles, and this is impacting us on so many levels. Great to have you with us here on the Oakland County Megacast. Bill Anderson, he's a specialist on local governments, finance and operations for the Southeast Michigan Council of Governments. Thank you for being with us, and happy holidays to you and your family as well.
And I'm looking forward to those cookies in the garage.
Exactly. That's going to wrap it up for the Monday edition of the Oakland County Megacast. We want to say thank you. Tyler and I will be back tomorrow at 10 a.m.